For people who are struggling with chronic lower back pain, the act of performing a movement such as bending forward to touch your toes is a motion that it is fine gets people so many different problems. It's a motion that can feel quite awkward. It can create a lot of tightness or a lot of tension within the body, or it's just a movement that hurts to the point where for a lot of people who are struggling with chronic lower back pain, just seem to learn how to avoid doing all forward bending movement at all costs. However, in this video, I want to share with you why having the ability to touch your toes is actually something that is very important and plays a huge role in terms of overall spine health and overall spine function, and why it is not something that I believe people should be learning how to avoid. Instead, I believe that people should be learning how to actively be fixing and restoring this motion over time. And then from there, I'll share with you what I believe are some of the most common underlying causes and explanation as to why this is actually happening in the first place and why it's not coming from an area where you may think. And from there, I want to share with you some of our favorite strategies in the form of various forms of stretches and exercises to be able to help you solve some of your toe touch problems as well, and hopefully help you restore mobility within your back in ways that you may not have thought possible. So what is it about this toe touch movement that is so problematic, and why is it so important for us to learn how to fix it? Well, number one, I believe that it is the most common mechanism of injury of how most people actually injure and hurt their backs. Because not a day goes by where we aren't working with somebody or don't hear somebody who actually injured their backs bending forward. Usually because they kind of bent forward too fast, or they bent forward at an awkward angle, or usually because they bent forward beyond what we would call their flexibility or mobility zone because they weren't warmed up or they weren't stretched out. And usually that's kind of when they feel something tweak, or they kind of just feel something give out or kind of go out within the back to the point when they wake up the next day, they can barely move, they can barely get out of bed because they're just kind of met with just kind of sharp or intense pain or spasm within their back, to the point where from that point on, they've always been hesitant to be able to bend forward ever since. We also work with a lot of people who have always been a little tight or they've always been a little stiff. Flexibility has never really been their strong suit. Is that, as they start to get older, they start to realize just how difficult, doing a lot of their kind of daily tasks, things like being able to do the laundry or be able to do house chores, sometimes being able to even put on their own socks or shoes, or be able to go out into the backyard and do some gardening, are all things that become increasingly difficult the less your back actually has the ability to be able to bend forward. Or it's just moving that hurts to the point where people are met with a lot of sharp pain. They feel a lot of pressure within their back. They might feel even pain either shooting into the hip or down into the leg anytime they try to bend forward, to the point where, again, people just seem to learn how to avoid doing all forward bending movement at all costs. However, while learning how to avoid forward bending movement might be an effective short-term strategy just to make sure that things don't get worse, long-term, it just seems to lead to way more problems than necessary. And it's just due to the fact that there are just so many movements that we as humans do throughout the course of the day that actually require our backs and actually require our bodies to actually have the ability to bend forward. And when we lack the ability to be able to bend forward, to be able to touch our toes, not only are we at significantly greater risk of pain or injury when we at some point do actually have to perform one of these movements and we don't have the mobility to be able to do so, or we always have to kind of learn how to bend in these weird or awkward ways. We're always trying to kind of lift from our knees or try to keep our backs in a very tight or very stiff or rigid position as possible. And what ends up happening is people just start creating, problems in other parts of the body just because the body just isn't moving naturally in the way that it was originally intended to be able to do so. Or sadly, we see people who just completely sacrifice or just give up on doing a lot of their favorite activities just because of this constant threat or constant fear of their back going out, or that they're physically incapable of being able to do so. People that are afraid of going on vacation with their families, people that are afraid of just going into the backyard and just doing a couple of minutes of working in their garden, people that give up on their favorite sports, people that are unable to lift weights, people that are afraid to be able to do yoga. Or sadly, even we see people who are, even new parents in their mid-30s who are physically incapable of being able to pick up their own 6-month-old just because their backs are in such bad shape. However, I feel a lot of this can be avoided, and that it's not necessary for people to just kind of live a life of complete avoidance of doing all these activities, so long as we actually understood how important being able to fix and restore this toe touch motion actually is, and actually understand what is actually causing this problem. Because I know that there are a lot of misconceptions that are out there, and specifically a lot of people who may have tried to fix this problem with various forms of stretches and exercises. And that the biggest misconception that we know that is out there is that most people seem to believe or blame tightness or tension within the muscle in the back of the leg known as the hamstring muscle. However, in this next demonstration, I want to show you why hamstring tightness is usually not actually causing the problem, and why actually stretching your hamstrings could actually not making your pain better, but in some ways could actually making your pain worse. And then from there, I want to share with you what I believe are the actual mechanisms as to what's actually causing it. And then from there, show you some ways to be able to assess to see if this is the actual problem, and then show you some of our favorite exercises to be able to help you solve some of these issues so that you too can hopefully help you restore your motion over time as well. All right, so what I'm going to do next is to show you a demonstration just to kind of highlight and go in much more detail and depth to explain to you what is the actual underlying cause and mechanism that's actually causing most people's inability to touch their toes, and where it's actually coming from, and why it's not coming from tightness within the hamstring muscle, which most people actually seem to believe, okay? Now, the most important thing that I want you to realize is that when anybody actually bends forward to touch their toes, that it's not just their hamstring muscle that is being put under stretch or being put under tension, but rather it is actually every single muscle fiber that resides within the backside of your body that's actually being put under stretch and actually being put under tension. And what we really try to do is really look at the body from a much more bigger picture perspective and really seek to understand how everything in the body is actually interconnected. And instead of viewing all of our muscles as individual muscles working separately, what we try to do is refer to all these muscles as a collective chain of muscles that are all working together. And what we try to call these muscles that reside within the backside of our body is, again, a chain of muscles known as the posterior chain. So what I'm going to do is to kind of use this orange band here, just kind of signify what I mean by this posterior chain. And instead of, again, viewing things as kind of a bunch of singular muscles, we want to try to view our back muscles as a one long chain of muscles that essentially runs from the back of my skull all the way in towards my neck, in towards my shoulders, into my back, into my hips, down into my hamstrings, down into my calves, and down into my feet. And that if I actually have enough flexibility or mobility within this posterior chain, then I should be able to bend forward with relative ease. I should feel no tightness, I should feel no restrictions, and should nothing be really getting in the way of me being able to touch the ground without any real problems. Okay. Now, it seems to happen for people, especially for people who are struggling with a lot of tightness within the back or a lot of stiffness within the back, or people that just have a lot of muscle knots, is something like this will happen, okay? So what we're going to do here is just to kind of break this rope down into two different halves. So if this kind of halfway mark just kind of signifies where my hips kind of meet here, all right? So everything from this halfway point down is to kind of signify my hamstrings down to my calves and to my foot. Anything from this halfway point is going to signify with everything that's going on within my back, up and towards my shoulder and towards my neck. All right, so for a lot of people, again, that have a lot of tightness within their back, or just have a lot of spasms, or just have a lot of restrictions within their back, is we're just going to tie a couple of knots within the upper half of this rope. All right, and again, this is going to happen for a lot of people who are struggling with their posture, or who aren't really doing much stretching or doing much flexibility work of their back itself, or just for people who are always kind of stressed, or always have or just who always carry just a lot of like chronic tightness or a lot of tension. Is something like this is actually going to happen, where I'm going to kind of tie a couple of these knots, because this is kind of what happens for people who have a lot of restrictions within their back with regards to their posterior chain. And what I'm going to do is just to kind of highlight to you what happens when I try to perform that forward bending movement now, right? So the first thing that you might notice is how much shorter this rope actually is. And that if I just want to like stand up straight, there's already a lot more tightness and just a lot more tension with this entire chain, just because of the fact that posterior chain is a lot shorter due to all the knots within on my back. And the thing I want to highlight is when I actually try to bend forward like so, is right when it gets about here, I actually don't want to go any further than this, because I feel so much tightness, I feel so much tension within this band, that if I go any further, I'm afraid the thing's actually going to snap. Okay, and this is what I believe is happening for a lot of people who have just a lot of restrictions within the entire chain itself, is that they just will lack the flexibility to be able to bend. However, the misconception is that what's going to happen is when I actually try to bend, is that what I'm going to feel is I'm going to actually feel a lot more of the tightness, a lot more of the tension actually coming from my hamstring and everything down below. And because I actually feel the tightness and the tension in this lower half here, that makes me feel like I actually need to stretch, or actually need to be able to elongate this area. But you can clearly see that that's not only actually going to actually solve the underlying issue, because of the fact that there are just so many restrictions within the back itself. And that if I actually try to stretch and elongate this, I'm actually just going to make things potentially worse, because I'm creating more tension and more tightness within the system, and still leaving some of the underlying root causes still unaddressed, okay? Now, that's the irony for a lot of people who have a lot of tightness within their back that are unable to actually physically bend it. It's actually coming from back tightness itself, and it's actually not coming from hamstring tightness in most cases. And the only way to actually fix this issue is to actually be able to identify and release all these knots and all these kinks, and just to hopefully restore the length and restore, and release some of that tightness within the back. Sometimes through various forms of hands-on manual therapy, various massage techniques, or obviously, with effective, stretches and ways to learn how to release tension within the muscle. Is that only by doing that and actually being able to identify and release some of these knots can I actually be able to, safely restore the length within that chain to the point where when I actually am able to bend forward, all right, only at that point is when I'll be able to bend forward with ease, without much pain, and without much resistance, okay? So what I want to do next is to share with you a couple of assessments that you can do just to kind of show you what this problem actually looks like when we're actually working with certain patients, so that we know that back tightness or back stiffness is actually something that we need to be able to address. And then from there, we're going to show you or highlight some of the most common causes of why this might actually be happening. And from there, based on what your problem may be, to show you some of our favorite strategies in the form of stretches and exercise to be able to help you solve some of these issues for good. So with that said, let's get right into the next part of this video. Okay, so what I want to share with you next are a couple of very simple self-assessments just to show you what this problem might actually look like. So if you are somebody who is unable to touch your toes due to the fact that it's your back is what's too tight and your back is too stiff, that it looks like and presents in a very specific way that we're going to show you in this demonstration. Okay, so with me today is my wife Twee, and she's going to be helping us through some of the demonstrations and also helping us through some of the corrective exercises and strategies that we're going to show you a little bit later in this video. Okay, so what we're going to do is have Twee just start with a simple toe touch just to kind of highlight what the back should hopefully look like in an ideal situation. Okay, so I can see here, Twee, she's able to touch her toes with relative ease. There's no pain, there's no tightness, and there's nothing kind of that's holding her back from being able to touch. But the thing I really want you to zero in on, what I really want to focus in on, is what her back actually looks like as she's trying to bend. So if I just drew a line from the base of her neck all the way down towards the lower back, what you see her is that her back is actually curving. It's actually creating a nice uniform arc or a nice uniform curve from her lower back all the way up and towards the base of her neck. And again, this is the telltale sign and one of the best signs or the best indicators that the back is bending and moving exactly the way that it should, and that there are no signs of any tightness or restrictions or any of those like muscle knots that we talked about in the previous part of this video. Okay, so Twee, go and stand up. So what we're going to share with you next is what it looks like for people who are unable to touch their toes due to the fact that their back is what's too tight and their back is too stiff, and the back is what's actually holding them from being able to touch. So Twee, go and demonstrate. So again, we'll work with a lot of patients who, as they try to bend or as they try to touch, when they try to bend over, it'll look something like this, okay? Where their upper back is trying to round, we start to see that their lower back from their middle back down to about here is kind of stuck in a straight line. And instead of the first demonstration where her lower back was actually able to curve and able to round it easily, her lower back is just unable to achieve that lower back curve, okay? And this is a sign that there's a lot of tightness, there's a lot of restrictions, or there's just kind of something that's holding her back from being able to bend forward from here anywhere towards about here. Okay, so Twee, go and stand up. Again, that's a telltale sign when somebody is trying to bend, and we see right away that their back actually isn't able to round and their back isn't curving, that is something that we want to be able to treat, and that is something we want to be able to release in order to be able to allow them to achieve a proper forward bending curve. Okay, so Twee, let's go and demonstrate just one more time. So again, in a proper situation, as you can see here, the big difference is the fact that her lower back and her entire spine is able to bend and round quite easily. And again, this means that there is no restrictions, there's no tightness, and there's nothing holding her back from being able to bend. So go ahead and stand up, and we'll just kind of show it to you one more time, just so you have an idea of what to look out for if you're trying to do this on your own. Do you want to demonstrate one last time, Twee, with the stiff back? Is that it might look something like this. So if you're watching yourself trying to bend in front of the mirror or having someone take a video, if you just see that there are any parts along your back or along your spine where it's just straight and it's just unable to bend, and there's just, again, this is a sign that there is something that's holding your back from being able to bend. Twee, and where do you feel the tightness and where do you feel the stretch?
I feel the tightness in the back of my legs.
Okay, and that's something that we really want to look out for, is that this, even though your back is tight and rounding, that you might still actually feel it's the tightness within the back of your legs and your hamstrings. Go and stand up as to what it actually feels like it's holding you back. what I really want to highlight is the fact that if your back actually isn't rounding, again, that is the first indicator that it's your back is too tight, your back is too stiff, and that's what actually needs to be released if we actually want to be able to fix and be able to release your toe touch over time, okay? So with that said, what we're going to next is to share with you a couple of important details in terms of what actually causes this phenomenon and what actually causes this problem to happen. And then we're going to share with you a couple of our favorite stretching exercises to be able to fix this problem over time. So with that said, let's get right into the next part of this video. Now, before we jump right into showing all the various stretches and exercises that are designed to be able to help you solve some of these problems, I first want to help you understand just how and why your back might actually be in the situation to begin with. Because depending on your situation and depending on your pain levels, depending on the severity of your symptoms, or depending on the location of where you actually feel symptoms when you actually try to bend, some of these stretches and some of these exercises just might not be right for you, at least at the current time. Now, while I believe that everybody should at some point have the ability to be able to bend forward and touch your toes, depending on your situation and depending if you are, again, finding yourself in one of these scenarios that I'm going to highlight, that usually means that there are other things that need to happen first before we feel your back is going to be ready to be able to respond best to doing some of these forward flexion, forward bending corrective exercises. Okay, so what I'm going to do next is just to kind of highlight a couple of very common scenarios that we see here in the clinic in which we would feel very confident that somebody is going to respond best to doing some of these forward flexion corrective exercises, as opposed to what you might want to do if you're finding yourself in, again, one of these other kind of pain buckets, okay? Now, the first scenario that we would typically see are for people who are just really stiff or who are really tight or just kind of lack just kind of general flexibility throughout their back. And especially when this person bends forward, that they don't have any sharp pain or they don't have any pain either shooting into the hip or down into the leg, but just kind of met with just kind of a general soreness, a general stiffness, or just, kind of like slight kind of like sore or achy pain. So if you find yourself in this situation, then I would say that you're definitely the best type of candidate to try to do some of these release exercises or to be able to work on trying to restore some of the flexibility within your back to be able to improve your forward bending movement over time. Now, if you are somebody who has a lot of sharp pain when you try to bend, especially if you just injured your back, a couple of days ago or maybe a week or so ago, and again, as you try to bend, you kind of feel something kind of grabbing at you, or just kind of feel this kind of really kind of sharp or intense pain, then what that usually means is that you have some form of a back spasm, and a back spasm is usually an indicator that the back is actually trying to protect itself and actually does not want you to bend forward, at least at the current time. So what typically means is that your back just needs a little bit more time to heal and that it is really not ready to be able to do some of these forward bending corrective exercises, at least at the current time. So what we typically do for people who are in this state is that they typically need a little bit more time to rest. Their backs just need a little bit more time to heal. And then once over time, it kind of evolves into a state where it is kind of more tight or is more sore or just kind of achy, but it's not sharp when they try to bend, then it's usually only at that point in which we feel confident for somebody to be able to try to restore some of these forward flexion exercises, especially on their own. Now, there's another scenario in which you might experience a lot of sharp pain when you try to bend, but you didn't just injure your back a couple of days ago or a week or so ago, but this is something that's been kind of going on chronically over the course of several months, or even for some people over the course of a couple of different years. Now, if you find yourself in this situation where, again, you have a lot of sharp pain, but it's more chronic, then I would advise that you probably not want to start with doing some of these forward flexion corrective exercises, at least quite yet. And what that typically means is that there are probably other underlying root causes of other surrounding parts of the body that are probably not doing their job correctly, which is actually what's causing the lower back to be in a chronic state where it's being overstressed and overused. And at that point, we typically want to do is be able to resolve and fix some of these other surrounding areas first, to be able to take pressure and tension and stress off the lower back, just kind of reduce some of the stress and reduce some of the inflammation first before we try to do some of these corrective exercises. Now, I did a much more comprehensive breakdown of some of these underlying root causes that I've put in the link in the description below. So if you're finding yourself in this situation, that I would try to, again, try to resolve some of these other root causes first. And then once your back, again, evolves into a state where it's just kind of more sore or more stiff or more achy, but kind of no sharp pain when you try to bend, that's the only time I would feel confident for somebody to try to do some of these forward flexion corrective exercises on their own. Now, the last scenario that I want you to know about is that if you experience any pain either shooting into the hip or pain shooting down the leg, or experience any numbness or tingling or loss of sensation, especially if that gets any worse the second you try to bend, then I would say that you definitely should not be trying to do any of these forward flexion exercises, because that could be a sign that you might have an acute or symptomatic herniated disc, in which case all forward bending, at least at the current time, is just a complete no-no. And what we typically do for people in this state is that we need to do a lot of different treatments, a lot of different strategies to be able to help resolve and relieve a lot of those nerve symptoms first. So again, as the pain is, does something we call kind of centralized back into the back, where again, the back is just kind of more stiff or more sore or more achy, but no nerve pain or no sharp pain when they try to bend. That's the only time in which we will feel confident and be able to try to restore some of these motions, especially if you're trying to do some of these things on your own. And the last thing I want to say is that the physiology behind this toe touch movement is obviously something that is very highly complex, and that it is always difficult to know exactly when somebody is actually ready to be able to restore the forward bending movement. And that I would always advise, especially if you have any kind of chronic sharp pain, or if any pain either shooting into the hip or down into the leg, that you are working with a very highly skilled or trained medical practitioner, such as a physical therapist, just to make sure you're back and make sure that your body is right and ready to be able to do some of these exercises. And that there are a lot of treatments and therapies that can actually be performed to help you quickly reduce a lot of the tightness that you may feel within your back. Ways to be able to get rid of a lot of those kind of chronic muscle knots that you may feel. Ways to be able to help calm down a lot of the tightness, a lot of muscle spasm that you feel. Or just ways to be able to kind of open up and restore a lot of the restrictions you may feel within your back that will enhance the ability for you to be able to do a lot of these corrective exercises I want to show you next, okay? So with that said, now let's get right into showing you all of our favorite exercises to be able to help you restore and fix some of these forward flexion movements so that you too can hopefully be able to touch your toes over time as well. Okay, so the first stretch we want to show you today is an exercise known as the cat stretch. So the cat stretch is the first exercise where will help you start to restore that kind of forward bending and rounding curvature across your lower back into your mid to upper back, and then from your upper back toward the base of your neck, across your shoulders as well. Again, this is an exercise that we are encouraging the forward bending motion across your upper back like so. And then you want to hold it for about 10 seconds. So 3, 2, 1, and come back down. So we're just going to go over some of the finer elements of form and technique to make sure that you get the most out of this exercise and to make sure that you're doing it correctly. So what I want you to do is to start by just kind of tilting and tucking your pelvis under. Just kind of pretend you have a tail and try to like tuck it underneath you. That's one of the most popular cues that works well for our patients. And that's from there, I want you to also squeeze and engage your abdominal muscles. By working on these two things, this will really start to encourage your lower back to start to create the kind of forward flexion or that kind of forward rounding curvature that we find is lacking for so many people who are unable to bend forward and touch their toes. And again, you should also feel like a light stretch and light pull across your lower back as well. And just hold it again for 3, 2, 1, and come back down. Okay. So what I want to show you next is what I believe the most common mistake that people do when they try an exercise like this that isn't really solving the issue. So it kind of looks like this, where people go and demonstrate tweet, where as they do this stretch, when they are really tight across their lower back, and when they try to do an exercise like this, they kind of dump too much stress into their mid to upper back and aren't really focusing on what's going on, at the level of their hips. They're not really focusing on the pelvis, and they're not working on the core. So you can see here is there is quite a bit of a curvature across her upper back, but her lower back still just isn't rounding. And again, this is what we don't want to encourage when you're doing this stretch, because again, this isn't really doing much to actually solve the underlying issue. So Twee, go and reset. And so we're just going to demonstrate it properly just a couple more times, just so you can really see the difference between what happens when you are rounding where you need to compared to where you shouldn't be. So go and demonstrate, Tweet. So again, starting by tucking that tail under, really getting those abdominal muscles to engage. And you can see a much more of a kind of uniform curvature occurring through her entire spine, instead of only kind of that rounding curvature occurring through her mid to upper back. Right, really start to try to focus on squeezing those abdominal muscles, and you should feel a nice pull and a nice stretch across your lower back as well. So again, movement through your pelvis, engagement through your abs, and just a bit of a stretch and a bit of pull through your lower back as well. 3, 2, 1, come back down. And let's just demonstrate it one more time, Tweet. So again, take a couple of seconds between each repetition. Make sure you just give your body some rest. And as we said in the previous section of this video, if you have any sharp pain with this, if you feel any intense grabbing or pulling of your back muscles, or if you experience any pain kind of shooting down into your hip or down into your leg, I would definitely stop this stretch. It just means your back just isn't ready for this type of movement quite yet. And that usually means that there are other things that need to happen before you get up to this stage. Right. But if you feel, again, engagement through your abdominals, if you can feel that motion occurring through your pelvis, you feel the presence of just a nice gentle stretch, but sometimes, just a little uncomfortable, that's fine across your lower back. Again, that's fine to push through.
rest tweet. But again, any pain that you just don't feel really comfortable with, that just means your back just isn't quite ready for this forward bending movement. But again, if you are able to feel some of the other qualities that we demonstrated, then this is a good stretch for you at a given time. So that's it for the first exercise for today. Now let's move into the next stretch. Okay, so the next exercise we want to show you today is an exercise known as the child's pose stretch. The child's pose is a very nice, relaxing stretch that will help you just kind of stretch and relax all of those soft tissue structures in your lower back into the forward flexion curve that we want to restore to help you restore your toe touch. So this is a stretch where you will start on all fours, like so. I'm just gonna have you start by just doing a very simple cat stretch. So just kind of rounding your lower back, just very gently, and then from there, just start to push and rock your hips down towards your heels like so, and just let your hands just kind of stay where they are as well. And then once you get down to this point, just try to take a couple nice deep breaths in. And on your exhale, just kind of let your chest and let your shoulders drop. And also let your head also start to rest towards the floor as well. And then from there, here again, just take a couple nice deep breaths and just slowly let your chest, let your shoulders relax, and just use your breathing just to make sure that you are slowly just letting your upper body just kind of relax closer towards the ground as you work in towards the stretch. Okay, so let's hold it there for a couple of seconds. And then once you start to reach the end of the stretch through here, you can start to increase the stretch that you get across your shoulders and through your spine just by slowly starting to crawl your fingers forward like so. Again, this will start to just increase the level of stretching that you're getting across all of those uh, muscles and tissue structures across the entirety of your spine. Again, from there, just take a couple nice deep breaths in. And then on your exhale, just let your chest sink. And you can also just crawl your fingers just a little bit further forward if you feel like you have a little more space. Okay. Just hold it there for 3, 2, 1, and come back up. And let's demonstrate it just one more time. So again, just starting with a simple cat stretch, just kind of rocking, and then from there, rocking hips back down towards your heels. Just going as far as you can, and then once you feel like you've reached your limit, just take a couple of nice deep breaths, and then from here, just let your head, let your neck, and just let your shoulders just kind of relax towards the floor. Again, this is a very relaxing stretch. This is a very passive stretch. This shouldn't be putting much stress or strain on your back at all. But you should start to feel just a little bit of a nice pull, a little nice stretch. And again, just kind of crawl those fingers forward just to increase the overall stretching that you're getting through your shoulders. All right. Again, this is one of the favorite stretches for a lot of our patients, especially in the very beginning stages of helping them restore their flexion, because it's quite easy. It isn't too difficult. And again, and oftentimes just feels pretty good. All right. 3, 2, 1, come back up. Okay, so that's it for the child's pose stretch. Now let's get into a couple of more isolated stretches to help us work on increasing the flexibility of a very important muscle known as the lats. Okay, so the next exercise we're going to show you is a modification off of the child's pose stretch, and it is an exercise known as a child's pose with a lat stretch. So to go and demonstrate, so we start on all fours, and just to start with a very simple cat stretch, and then just rock your hips back down in towards a child's pose. Let your chest sink, and just also start to crawl your fingers forward like so. And then from here, we want to start to increase the stretching that we feel along the muscles along your side. So what Twee's going to do here is just to place her left hand a couple of feet over towards her left, and then take her right hand just to kind of place on top, and just kind of anchor her hand down onto her left hand like so. And then this is going to significantly increase the level of stretch and pull that you feel along this muscle along your side known as the latissimus dorsi. And then once you start to feel a stretch, take a couple nice deep breaths in. On exhale, just slowly shift your entire weight back over towards the right. You just try to get your back just kind of centered back towards the spine while keeping your hands just kind of anchored onto the floor. And this is going to significantly enhance the stretching that you feel along this side muscle known as the lat. Now, the lat is a very important muscle to stretch because of the significant amount of connections that this muscle has on top of the soft tissue structures along the lower back known as the thoracolumbar fascia. Okay, and we find that for a lot of people who have a lot of tightness and restrictions in this area, this lat muscle is one of the major contributing reasons as to why this area might be so stiff and so locked up. Okay, 3, 2, 1, and come back to the center tweet. And then once you do about 5 nice deep breath cycles from there, just come back to the center just for a couple of seconds, just to come back into a child's pose. And then we're going to demonstrate this exercise in terms of what it looks like on the right side. So tweet, let's do the stretching towards your right hand to be able to stretch your left lat. So again, as you can see here, she's just kind of bringing her right hand a couple feet towards her right, using her left hand just to anchor on top of her right hand. And then from here, once she starts to feel a stretch along her left lat, she's going to slowly start to shift her upper body weight back towards the center. And this is going to significantly increase the level of stretching, level pull that you feel along this side muscle through here. Again, this is an exercise that shouldn't hurt. It shouldn't cause any increased pain. And you should feel a pretty good stretch along the entirety of the muscle along your side, and also a gentle pull, into your lower back as well. Again, this is a stretch where a lot of our patients, feel it just feels really good for them. And it does, over time start to significantly increase the ability for them to bend forward and be able to touch their toes as well. 3, 2, 1, and let's come back to the center. Okay, so that is it for the child's pose with the lat stretch. So from here, let's move on to showing you how to do a couple of simple soft tissue releases along some of those back muscles using a foam roller. Okay, so the next exercise we're going to show you is a self massage exercise that is designed to help you release a lot of the kinks or a lot of the knots or just a lot of the stiffness that you may have across your mid to upper back with the use of a device known as the foam roller, like so. Okay, so what Twee's going to do, she's going to start by just laying on the foam roller like so, and she's going to laying on it crossways. Right, she's going to place the roller just kind of right across her shoulder blades to start, and she's going to place her hands behind her neck just to support her neck. Okay, and what she's first going to do is she's going to just start to slowly just kind of work her back and work her spine just up and down the roller, just to start to get a little bit of release, just to get a little bit of work, and just get a little bit of pressure across those muscles that run up and down your spine, like so. Again, we want to make sure that you really are focusing only on the mid upper back through here. We don't want you to do much foam roller work as it gets into the lower back. Again, the idea behind this is we want to release tension across of the muscles across your upper back to help relieve some of the tension, relieve some of the stress and pressure off the muscles of the lower back. Okay. This is something that we give to a lot of patients who are struggling with poor posture, people that spend a lot of time sitting, who have a lot of stiffness within their upper back. And sometimes that is what's actually creating the stress and creating the pull and why the lower back is so tight all the time. Okay. So again, she's just kind of slowly working up and down her spine, just working on all those kinks and all those muscles along the mid to upper back, like so. Right? If you don't feel surprised if you feel some knots or if you feel some bumps or feel some kinks along the way, just start to slowly work on releasing those areas over time. This is very similar to giving yourself like a deep tissue massage. Okay, just getting some circulation, breaking up some of those adhesions, and again, just starting to get refamiliarized with what's actually happening across your mid to upper back, like so. Okay. So again, just a couple rolls up and down is what you can do to start. And what I want to do next is have Twee start to work on rolling her lat muscle. Okay. So again, so have her shift her weight back over towards her left side, like so, and then just start to again kind of do the same thing where she's just kind of slowly rolling up and down that side muscle again. Right. So again, this lat muscle is a very, very important muscle because of how large this muscle actually is, and because of all the important connections that it has onto your spine as well. Again, this is a muscle that attaches the entire soft tissue structure known as the thoracolumbar fascia as it connects, onto the back of your shoulder. And for a lot of patients who, again, sit at a desk a lot or just aren't moving or stretching a lot, this is one of the most important muscles to learn how to release and learn how to stretch. Because once this muscle starts to let go, once this muscle starts to loosen up, this is where we're going to start to get a lot of that forward bending motion back within our body. Okay. And again, so you can see Twee is just kind of slowly working up and down the side muscle, right? And what you might feel along the way, Twee, show them a trigger point release when you find one. So she's just kind of, okay. So once she finds a muscle that's really tight or really tender, and she's feeling one just kind of in the back of your shoulder blade, like so, you can also stay here on these areas and just slowly let your body just kind of sink and just kind of relax into these muscles. Okay. And again, these little tender points, these little points at which that may feel a lot more tighter, a lot more tender than the others, are known as trigger points, or also known as muscle knots. Okay. So you can also use the roller just to learn how to slowly release some of those knots over time, just to start to increase the level of motion that you get through the muscle instead of just kind of grinding, instead of just kind of like, mashing through the muscle. Okay. So again, another very effective technique that might take a little bit of practice, but again, is really effective at helping you not just kind of mash away at those muscles, but to really start to undo some of those more tender or tight spots that you may feel, as you start to scan your body when you're applying this roller technique. Okay. So again, let's roll onto the right lat now, just so people can see what it looks like on the other side. So again, just kind of moving off the center, and just kind of working up and down the muscle along the shoulder blade as it again extends all the way down towards the side through here. And again, I really wouldn't go anywhere past this point. We don't want you to really be focusing too much on creating a lot of pressure in your lower back. Just really isolating this stretch across the upper back, across the ribs, and just kind of in back and towards the shoulder blades like so. And just start to familiarize yourself with what's actually happening back through there. A lot of our patients are just really just kind of shocked and surprised at how tight or how tender or how sensitive or just how many bumps and just kind of like little clunks they feel when they start to work on these areas. All right, people are just a lot of times just have no idea what's actually happening across the mid to upper back. But once we start to get some some pressure, once we start to get some massage, once we start to get some release across these areas, we start to break out some of those adhesions. We start to increase the level of blood flow and circulation to those areas. Again, it's very similar to just kind of giving yourself a nice deep tissue massage. Okay, right. So let's have it roll up and down a couple more times. 3, 2, 1. Okay, so that's it on how to perform a very thorough soft tissue release across your upper back and your lats, which will absolutely help you increase the overall level of mobility and flexibility of your spine and help you take a tremendous amount of pressure off your lower back when you're trying to bend forward. Okay, so this next exercise we're going to show you is a very simple stretch that you can do while seated. And again, this is another very simple and very easy stretch for a lot of our patients, especially in the beginning stages of teaching them how to restore the overall flexion curvature across their spine. So Twee, go and demonstrate. So what Twee's going to do is she's going to just, very simply just kind of sit at the edge of her chair and just slowly start to, push her hands down towards her feet. And then for a lot of patients, they're going to kind of start to feel some tightness or start to feel some pull or some resistance about halfway down or about 2/3 of the way down. And then once you start to feel some of that tightness, once you start to feel some of the restriction, just stay there for a couple of seconds and take a couple nice deep breaths in. Okay, and then once you feel you're ready to move a little bit further into the stretch, once things have calmed down a little bit. Take a nice deep exhale, and on your exhale, just slowly start to just push yourself into a slightly deeper stretch like so. And just try to hold that there for a couple of nice shallow breaths like through there. Okay, just take a couple shallow breaths, just give your body a chance to adapt, just give it a chance to adjust. And then once you're ready to advance into a deeper stretch, you can slowly start to push your hands a little bit closer towards your toes like so. Again, our goal is to help you increase the forward bending curvature and forward bending angle across your back. And it's much easier to do this because while seated, we're taking away a lot of that tension, a lot of the tightness off of the muscles in the back of your leg and your hamstrings, and really helping you just start to increase that forward bending curvature across your spine as well. And then from here, just slowly just kind of crawl your way back up. Use your hands to kind of march up your legs just to make sure you're not putting too much strain on your lower back. All right, and then we're just going to show it from a slightly different angle from the side through here. All right, so now we'll just demonstrate what it looks like on the side here. So what Twee's going to do is just, again, slowly start to move her hands and try to just kind of bend as far forward as she can. And again, letting her shoulders sag, letting her upper back just kind of get familiarized with getting into that rounding position as you can see through here. Again, not forcing anything, just go as far as you can until you start to feel some stretch or just a slight pull across your spine, and then using your breathing just to guide yourself a little bit further into the stretch once you feel your back is ready. Okay, so you can see here, her back is starting to is obviously able to curve and round really, really nicely through here. But again, if you have any increased pain, if you have any increased pull or tightness in your back or any pain, down your leg at all, this is a stretch that's not correct or not right for you at the given time. But if you just kind of feel a nice pull, you just kind of feel a nice stretch across the entirety of your back. And then if you feel like you're slowly able to start to increase more mobility over time, then this is one of the best stretches that we give to a lot of our patients who are in that kind of stage where their bodies are ready to start to increase their flexion mobility. Again, once we've kind of cleared them past some of those, those kind of immediate kind of warning signs to make sure that they are ready to do this type of stretch. But again, if you are able to do the stretch, it's one of the best ways to start to increase the mobility across your spine. And again, it's not going to put a lot of stress or strain along your glutes or along your hamstrings as well. So from here, just slowly start to kind of claw your hands back up towards your legs so you're not overstraining your back as you come back up. So that's it for a very simple seated toe touch stretch. Now let's move into the very last exercise for today. Okay, so the last exercise we want to show you today is quite a bit different from the first exercise we showed you, which focused a lot more on stretching and a lot more on just mobility and helping you restore the overall forward bending flexion curve of the spine. But this exercise is going to focus a lot more on helping you create strength and stability within your back and within your legs, just to help you prevent future injury and just to again help you restore some of the last bits of mobility that you may not have. All right, so this is an exercise known as the short stop exercise, which Twee is going to demonstrate a couple times. Again, this is an exercise that we give for people usually towards the end of their therapy. Once we're starting to help them rebuild the strength, rebuild the muscles, or once they actually have restored the toe touch mobility of their back, and we're looking for ways to help them get back into being able to, build strength or just be more functionally, capable within their backs over time. Okay. So what Twee's going to do, she's going to start by just starting with her sliding her hands down towards her knees, kind of like a shortstop would, like if you were to picture like a baseball player. And then from there, the most important thing she's going to do is take her back from a rounding position into a nice straight, or also known as a neutral position. Okay, so this is going to involve her learning how to activate all the tiny muscles along her spine, just to get her back into a nice straight position as she can. And then from there, she's going to just kind of engage her lats to pull her shoulders down away from her ears. And that's going to just increase the level of activation and stability that she's going to get along her spine as well. And then from there, we want to just kind of get her lower body nice and secure. So she's going to push her knees out towards the side. And then what that will do, that will engage some of the external rotator muscles of her hip, just to increase the level of stability that she's going to get along her backside. And the last thing she's going to do is just going to slowly start to shift her weight up, her hips up towards the ceiling, just to increase the overall level of tension that she's going to create along the entirety of her glutes and her posterior chain. And she's going to hold it there for a couple seconds. And then from there, she's going to pull her hands back behind her back and make sure that she's standing up nice and straight with good posture and keeping her back straight as well. And at the top, she's going to finish by just squeezing her glutes and squeezing her abdominal muscles. And just lean back just a slight bit, Twee. Are you a little further? You're a little forward. Perfect. And again, we just want to make sure that you're standing with nice alignment at the top. Okay. So we're going to have her demonstrate a couple more times. Okay. So again, she's going to start by sliding her hands down towards her knees. The first thing she do, she's going to get her back nice and straight, nice and equal, nice and level, like so. And she's going to just kind of pull her shoulders down away from her ears just to engage her lats, just to increase the level of stability she's going to get across her entire back. Going to push her knees out towards the side. And then from there, she's going to finish the move by lifting her hips up towards the ceiling, just to increase the level of stretch and activation that she's not just getting through her hamstrings. Again, we're teaching how to create massive levels of stability across the entire posterior chain, right? And again, this is not just a hamstring stretch. This is much more of an active strengthening exercise. Hands behind the back. Hold it there for a second and slowly stand up, nice and tall, nice and straight. Push those hips forward at the top and make sure that you're nice and tall and nice and straight at the top. All right. So we're just going to demonstrate just a couple more times. And again, this is a very important thing that we want to stress, is that I know that we stressed at the beginning of this video the importance of learning how to create flexion or forward bending through your back, but that is a prerequisite that I feel a lot of people don't have because of the fact that their backs are so tight and so stiff in ways that they aren't even aware. Okay. And this is an exercise that we will give again towards the later edges of therapy, when we are trying to help people learn how to prevent future injury and helping them just kind of unlock the door to be able to do other forms of activity and exercise that involve bending forward, but with some type of lifting, some type of load, or some type of just kind of weight bearing. Okay. And that, again, this is something that we do to help you just increase the levels of safety and stability along your spine by teaching you how to engage and increase the levels of activation of all the muscles along the entire chain, from the top of your shoulders into your upper back, through your lower back, into your glutes, into your hamstrings, down to your calves. All right. Learning how to activate and use those muscles as one unit is the most important part about this exercise, and what we really want to stress within this movement. Okay. All right. So last time we're going to demonstrate again, straight back. Again, going from a rounded to a straight back is a very important thing to learn, because that's going to help you increase the level of stability within your spine. Engage and pull those shoulders down to engage those lats, knees out, hips up. And I really want you to understand that when your back is straight like this, when you actually learn how to engage all the right muscles, that it is the most effective way to be able to increase the levels of safety. And it's almost impossible for your back to actually get hurt when it's straight like this. Okay. So learning how to create that stability is the most important thing that we want to teach you. Right. Shoulders back, back straight, chest up, stand up nice and tall, nice and straight. Hold it for 3, 2, 1. Okay, so that is it for our toe touch program. All right. Again, we took you through various forms of different forms of stretches to help you increase the overall level of mobility and flexibility across your spine. And then from there, we've shown you an example of one of our favorite ways to be able to help you increase levels of strength and stability along your back, which we feel is a very, very important piece towards the end of the rehab process. Okay, so that's it for the video today. We hope that this helps, and we hope to see you again next time. So take care and have a wonderful day.